Hi, my name is Seema Sood, and today is April the 14th, and my client here is coming in today with some shoulder pain. Hi, Mr. Singh. I'm Seema. I'm your therapist for today, and I believe you're here today because you're getting some pain or discomfort in your shoulder. Is that correct?
Yes.
Okay, perfect. Can you show me exactly where this pain is?
It's in my shoulder here.
Okay, but when did this happen?
I started a couple of weeks ago.
Okay, so a couple of weeks ago. And how did this happen?
It happened in the gym.
Okay, so what do you do right now to relieve the pain?
I just take Tylenol or put some heat on it.
Okay, and what makes the pain worse?
When I'm moving my arm.
Okay, so does the pain normally stay around this local area, or does it travel down anywhere else?
It's just in the local area.
Okay, perfect. Okay, so what we're going to do is a couple of assessments just to see. So the first is going to be a posture assessment. If I can ask you to just please stand up. Okay, so you can just, if I can ask you just to face the wall, please. Thank you. So I'm just going to make sure all your shoulders are elevated properly. I'm going to check the... Okay, perfect. Can I ask you just to turn around and face me, please? Thank you. So we're going to do a couple of range of motion testing for the affected arm. The first one is going to be just taking your arm towards the sky straight up and ahead of you. Relax. Any pain or discomfort? You can relax it down.
No.
Okay, perfect. Can I ask you to take the arm back? Any pain or discomfort?
No.
Bring it back. Now can I ask you just to take it right across towards your body? Any pain or discomfort?
No.
Okay, relax. And now gently we're just going to ask you just to raise the arm up and let me know if there's any pain or discomfort. Pain or discomfort?
Okay.
Okay, relax. Thank you. So what we're going to do next is a couple of testing. So the first one I'm going to be doing on you is going to be called the drop arm test. So with that one there, we're going to actually just take your arm straight up to 90 degrees. I'm going to be holding it so you can just relax. And as soon as I let go, try to bring your arms down slowly, okay? Okay, so I noticed that your affected arm did come down faster, so definitely there is some kind of weakness. Was there pain?
Yes.
Okay, perfect. So the next one we're going to go ahead and do is I'm going to ask you to bring your arms out up 90 degrees. Bring your arms slightly forward to 30. Thumbs down. So I'll be placing my hands right above here, and then I'm going to be pushing down. As I push down, I want you to try to gently just lift up and let me know if there's any pain. Go ahead and resist. Any pain?
Yes.
Relax. Where was the pain? In your, okay, perfect. So what I'm going to do is one last testing, which is called the painful arm. So with this one here, I just want you to slowly start to take your arms all the way over your head. And now, what we're going to do slowly, I just want you to start to bring it down. And just let me know about where, if you have any pain, where does the pain start? Go ahead.
Yeah.
Pain, I'll keep going. Let me know when the pain stops.
Stops.
Okay, so you're comfortable there?
Yeah.
Okay, perfect. So now for the next one, we're just going to do some muscular testing as well. So can I please ask you to lie down and place your head on this side of the bed? Okay, so the first one we're going to do is called muscle energy technique. With that one there, I'm going to actually take your arm, flex it over to your shoulder. We're bringing it out. And I just want to check your range of motion here. Okay, so I can tell that you've got good flexibility going back into lateral, but in internal there is some restriction. So here what I'm going to do is place my hand on top. I'm going to be gently pressing down, and I want you gently to push into my resistance, okay? Go ahead. 5, 4, 3, 2, 1. Relax. We're going to bring it down a little bit more. Good. I'm going to hold, and I want you to push up. Go ahead. 3, 2, 1. Relax. Okay. And we're going to do it one last time. Please push into my hands. 5, 4, 3, 2, 1. Relax. So we're just going to gently stretch it out. Perfect. Now I'm just going to ask you to relax. The next technique I'm going to be using on you, it's called the strain counter strain. So with this one here, there might be a little bit of discomfort at first, but you tell me once the comfort is released. I'm going to just place my hand on top of your supraspinatus muscle. So just right above your spine of the scapula here. And now I'm going to ask you to raise your hand up. Is it tender?
Yes.
Okay, so we're going to take your arm out into an external rotation, and then I'm going to bring the arm down and back. How is that? Because now what we're doing is shortening the muscle. Is that better? Yes.
Yes.
I'm going to hold it here for about 90 seconds or until I can feel that the tissue is releasing. So you just focus on your breath. Are you comfortable?
Yes.
Okay, perfect. Okay, I'm starting to feel that there's some starting to get released here. So I'm going to slowly start to bring your arm back into neutral. Relax your hands down and let me know. How's that? Has the tenderness improved?
Yes.
Awesome, perfect. Okay, great. I'm going to ask you please to have a seat up. So what I have noticed with all the assessments that we've done, that there's definitely some pain or impingement of your supraspinatus muscle. So what I am personally recommending is that if you can try to come here at least for the next 6 weeks, once a week, so we can continue working on that muscle.
Okay.
In the meantime, what I am asking you to do is when you go home, is to try to do some exercises to help stretch out the supraspinatus muscle. And you'll be doing these exercises at least 3 times a day. And each time, try to do at least 3 sets and holding it for 30 seconds. So the first one I'm going to ask you to do, actually let's just take it to do only one for now to see how you feel. So you're going to take your affected arm, which is this one, and you're just going to bring it behind your back. And with your other arm, the non-affected arm, I want you to grab on to your wrist of the affected arm, and I want you to just gently pull. Relax, pull, until you get to a good comfortable point, and then I want you to hold it there for 30 seconds. And just focus on your breath. There shouldn't be any pain at this point. If there's pain, then you can gently release a little bit. How do you feel?
Feel a little better.
Okay, perfect. Relax. So try to do this at least 3 times a day. I do recommend try to warming up the area before you do stretch. So you can warm with a heating pad, or you can take a nice warm shower. But whenever you do, just make sure the area is warm before you do any stretches. Okay?
Yes.
Do you have any questions for me?
No.
Okay, and then one last thing I'd like to tell you is that when you're trying to sleep at home, do not sleep on the affected side for now. You can try sleeping on your back with a towel propped up underneath, just so that there's not too much pressure being put on it. Or you can try sleeping up in a reclining position on the bed. But just whatever you do, just try not to sleep on the side of the affected pain, okay?
Okay.
Anything else?
No.
Okay, perfect. Thank you. Have a